Comprehensive NCLEX RN Practice Exam 13-2026. Question 1. A pediatric nurse is performing a routine assessment of a 1-month-old infant. Upon assessment, which of the following findings warrants further investigation by the nurse? Select all that apply. A. Abdominal respirations. B. Irregular breathing rate. C. Inspiratory grunt. D. Nasal flaring. E. Cyanosis. Normal infant breathing is abdominal and irregular. Grunting, nasal flaring, and cyanosis are signs of respiratory distress requiring immediate investigation. Question 2. Among the following potential complications, which one is primarily linked to the postmature status of the fetus, 42 weeks? A. Excessive fetal weight. B. Low blood sugar levels. C. Depletion of subcutaneous fat. D. Progressive placental insufficiency. As a pregnancy exceeds 42 weeks, the placenta begins to age and lose efficiency, leading to progressive placental insufficiency and potential fetal hypoxia. Question 3. A client who had a total hip replacement 7 days ago provides feedback. Which statement is most concerning and necessitates immediate intervention? A. I have bad muscle spasms in my lower leg of the affected extremity. B. I just can't catch my breath over the past few minutes and I think I am in grave danger. C. I have to use the bedpan to pass my water at least every 1 to 2 hours. D. It seems that the pain medication is not working as well today. Sudden shortness of breath, dyspnea, in a post-surgical orthopedic patient is a classic sign of pulmonary embolism, a life-threatening emergency. Question 4. A 33-year-old male with heart failure was started on furosemide. Which statement suggests he may be experiencing a negative side effect? A. I was surprised to see my weight jump up by 5 pounds in just a few days. B. I've noticed some swelling around my ankles by the end of the day. C. My stomach has been feeling upset lately, especially after I take the pill. D. I haven't been as hungry this past week. Furosemide is a diuretic. A sudden weight gain, fluid retention, indicates the medication is not effective or the heart failure is worsening. Question 5. A 32-year-old pregnant woman has 3-year-old twins at home and a miscarriage 10 years ago at 12 weeks gestation. How would the nurse document gravida and para? A. Gravida 2, para 1. B. Gravida 3, para 2. C. Gravida 3, para 1. D. Gravida 2, para 2. Gravida is the number of pregnancies, current plus twins plus miscarriage equals 3. Para is the number of births reaching 20 weeks, twins equals 1 birth event. Question 6. Which nursing intervention would be most effective in promoting the healing of a venous stasis ulcer in a client also experiencing fatigue and weight loss? A. Apply dressing using sterile technique. B. Improve the client's nutrition status. C. Initiate limb compression therapy. D. Begin proteolytic debridement. While compression is standard, the client's systemic symptoms, fatigue/weight loss, suggest a nutritional deficit that must be corrected to provide the building blocks for tissue repair. Question 7. A nurse is to administer meperidine, atropine, and promethazine IM. What is the priority action before administration? A. Verify the informed consent is signed. B. Have the client empty their bladder. C. Check the client's vital signs. D. Explain the medication effects. Safety and legal requirements. Consent must be verified before administering preoperative sedatives that alter the client's mental status. Question 8. Which of these statements best describes the characteristics of an effective reward feedback system? A. We should provide specific feedback immediately after a task is completed. B. Everyone should get feedback in equal amounts regardless of performance. C. Always begin with a compliment before providing criticism. D. We should set performance expectations so high that only a few can reach them. A. Effective feedback is most impactful when it is specific and delivered as close to the event as possible. Question 9. The nurse determines the client needs additional teaching if the multiple sclerosis patient makes which statement? Select all that apply. A. I can still incorporate weightlifting into my regimen. B. I believe it's essential to exercise to the point of exhaustion. C. It's reassuring that I can still engage in aerobic exercises. D. I assume I should exercise without taking any breaks. MS patients must avoid overexertion, exhaustion, and overheating, as these can trigger an exacerbation of symptoms. Question 10. A nurse is evaluating home care for an 80-year-old with advanced Alzheimer's. Which statement by the daughter is of utmost importance? A. We make sure mom gets at least 2 full meals a day. B. We've been attending a support group discussion every week. C. We've installed safety bars and set up 24-hour alarms on all exit doors. D. We've organized a pillbox, and she takes it 3 times a day. Safety is the priority in advanced Alzheimer's. Alarms and bars prevent wandering and falls, which are the most common causes of injury. Question 11. Which of the following medications would be contraindicated if the patient were pregnant? Select all that apply. A. Warfarin, Coumadin. B. Finasteride, Propecia. C. Selexib, Celebrex. D. All of the above, plus transdermal nicotine. Warfarin, teratogenic, finasteride, hormonal interference, Selexib, ductus arteriosus risks, and nicotine are all contraindicated or high risk during pregnancy. Question 12. The patient has photosensitive reactions to medications. Which of the following drugs is associated with photosensitive reactions? Select all that apply. A. Ciprofloxacin, Cipro. B. Sulfonamide. C. Norfloxacin, Norexin. D. All of the above, including Accutane. Fluoroquinolones, Cipro/Norexin, sulfonamides, and isotretinoin, Accutane, are all well known for causing photosensitivity. Question 13. Which of the following of the patient's medications is least likely to cause urine discoloration? A. Sulfasalazine. B. Levodopa. C. Phenolphthalein. D. Aspirin. Sulfasalazine, orange, levodopa, dark, and phenolphthalein, red/pink, cause discoloration. Aspirin does not typically change urine color. Question 14. Which of the following drugs, if found inside the fridge after a power outage, should be removed and replaced due to incorrect storage? A. Nadolol, Corgard. B. Humulin N injection. C. Urokinase, Kinlytic. D. Depoetin alpha, Epigen. Nadolol, Corgard, should be stored at room temperature. Insulin and epoetin require refrigeration. Question 15. Which of the following immunoglobulins is the only one that will provide protection to the fetus in the womb? A. IgA. B. IgD. C. DGA. D. IgG. IgG is the only immunoglobulin class capable of crossing the placenta to provide passive immunity to the fetus. Question 16. Which of the following is the most significant action that the nursing student should take immediately after a needle stick injury from an AIDS patient? A. Immediately see a social worker. B. Start prophylactic AZT treatment as soon as possible. C. Start prophylactic pentamidine treatment. D. Seek immediate testing for HIV to establish a baseline. Post-exposure prophylaxis, PEP, with antiretroviral medications, like AZT, should be initiated as soon as possible, ideally within 2 hours, to be most effective. Question 17. A diabetic marathon runner reports an inability to urinate for 24 hours. Which complication is most likely? A. Atherosclerosis. B. Diabetic nephropathy. C. Autonomic neuropathy. D. Somatic neuropathy. Autonomic neuropathy in diabetics can lead to a neurogenic bladder, causing urinary retention. Question 18. A 14-year-old ballet dancer with a BMI of 18 reports induced vomiting and severe constipation. Which condition is most likely? A. Multiple sclerosis. B. Anorexia nervosa. C. Bulimia nervosa. D. Systemic sclerosis. While anorexia involves low weight, the specific mention of induced vomiting, purging, is the hallmark of bulimia nervosa. Question 19. A patient with myeloma reports confusion, constipation, abdominal pain, and polyuria. Which condition is most likely? A. Diverticulosis. B. Hypercalcemia. C. Hypocalcemia. D. Altitude sickness. Multiple myeloma frequently causes bone breakdown, leading to hypercalcemia. Symptoms include moans, constipation/pain, stones, groans, and psychiatric overtones, confusion. Question 20. Under which circumstances would Regam most likely be administered to the mother to prevent hemolytic disease? A. When the mother is Rh positive and the infant is Rh positive. B. When the mother is Rh positive and the infant is Rh negative. C. When the mother is Rh negative and the infant is Rh positive. D. When the mother is Rh negative and the infant is Rh negative. Regam is administered to an Rh negative mother who carries an Rh positive fetus to prevent the mother from forming antibodies against the fetal blood. Question 21. Which of the following statements made by a nurse would not be correct regarding PKU? A. A Guthrie test can be utilized for diagnosis. B. In PKU, the urine has a high concentration of phenylpyruvic acid. C. Mental deficits are clinical manifestations in untreated PKU. D. The effects of PKU, once manifested, are completely reversible. The neurological damage and mental deficits caused by untreated PKU are irreversible. Dietary management prevents damage but cannot reverse it once it occurs. Question 22. A CHF patient took an overdose of aspirin. Which complication should a nurse most closely monitor during acute management? A. Onset of pulmonary edema. B. Metabolic alkalosis. C. Respiratory alkalosis. D. Parkinson's disease type symptoms. Salicylate toxicity can cause increased capillary permeability, leading to non-cardiogenic pulmonary edema, which is especially dangerous in a CHF patient. Question 23. What should be the charge nurse's primary responsibility for a blind and deaf patient post-abdominal surgery? A. Let others know about the patient's deficits. B. Communicate with your supervisor your safety concerns. C. Continuously update the patient on the social environment. D. Provide a secure environment for the patient. For a patient with profound sensory deficits and anxiety, providing a secure, predictable environment is the highest priority for safety and recovery. Question 24. What is the best instruction for a COPD patient who lives in a two-story house to manage respiratory challenges? A. Practice deep breathing techniques regularly. B. Cough regularly and deeply before climbing stairs. C. Use a bronchodilator and wait for a few minutes, then cough. D. Focus on increasing oxygen intake during meals. Using a bronchodilator first opens the airways, and waiting allows it to take effect. Coughing then clears secretions, maximizing lung capacity before exertion. Question 25. Which clinical sign would most likely be present in a 6-month-old infant with a congenital heart defect? A. Slow pulse rate. B. Weight gain. C. Decreased systolic pressure. D. Increased respiratory rate. Tachypnea, increased respiratory rate, is one of the earliest and most common signs of congestive heart failure in infants with heart defects. Question 26. Which characteristic is not typically associated with Down syndrome? A. Simian crease. B. Brachycephaly. C. Oily skin. D. Hypotonicity. Down syndrome is typically associated with dry, cracked skin, not oily skin. Question 27. While on alteplase, TPA, therapy for myocardial infarction, the nurse plans to prioritize which of the following? A. Observe for neurological changes. B. Monitor for any signs of renal failure. C. Check the food diary. D. Observe for signs of bleeding. TPA is a thrombolytic that significantly increases the risk of hemorrhage. Monitoring for any signs of bleeding, internal or external, is the absolute priority. Question 28. Which of the following foods should the nurse recommend as containing the highest concentration of folic acid? A. Green vegetables like spinach and broccoli. B. Yellow vegetables like bell peppers. C. Carrots. D. Milk. Green leafy vegetables, organ meats, liver, and legumes are the richest natural sources of folic acid. Question 29. Which of the following should the nurse educator highlight as not being linked to meningitis? A. S. Pneumoniae. B. H. Influenza. C. N. Meningitis. D. Cl. difficile. C. Difficile is a gastrointestinal pathogen. S. Pneumoniae, H. Influenza, and N. Meningitis are the primary bacterial causes of meningitis. Question 30. Considering the turnover and production of red blood cells, how long does a typical red blood cell live? A. 45 days. B. 60 days. C. 90 days. D. 120 days. The average lifespan of a healthy human red blood cell is approximately 120 days.